Hello. So I'm going to be talking to you about postoperative concern / care for skin cancer reconstruction or lesion excision. So after the procedure, you'll have an incision that's closed with sutures. These sutures are, usually left in place for around 7 days. 5 to 7 days is the norm. Sometimes a little bit longer, sometimes a little bit less. You may also have a dressing on there, which is a kind of a pressure dressing. The pressure dressing usually stays in place for around 24 hours to 48 hours. We'll have you remove the dressing at home, and that dressing can be, peeled off. It's usually tape or a sticker, kind of peeled off from the skin. I usually allow people to shower at 24 hours. So sometimes the best way to remove the dressing is to go take a shower, kind of lift up the dressing a little bit, which will allow it to get wet, and then you can kind of peel it off. So the dressing can come off at 24 hours. After the dressing's off, you'll see the incision line. That incision line should be kept moist with bacitracin or Neosporin for 3 days. After 3 days, transition to Vaseline. The Vaseline is important because the antibiotic ointment can actually give you an allergy. So after 3 days, you transition to Vaseline. The reason you want to keep it moist is because you want to prevent crusting or scabbing at the site. It actually helps it heal faster. Like I said, you can take a shower at 24 hours, but you don't want to submerge it underwater like swimming or a hot tub or anything like that until it's completely healed. You definitely can have a fair amount of swelling at the site. You can have bruising at the site or even in other areas, which sometimes can be surprising. So below the area where the incision is. That's all normal, and you can actually ice the area if you want. Make sure you keep a barrier between the skin and the ice, so it's like a wet cloth. And we usually say 20 minutes on, 20 minutes off, for the first 24 hours in particular. You can also keep your head elevated because that will help decrease the swelling at the site. I'll usually give antibiotics to prevent infection, so you'll take those orally. Pain medicines I sometimes give. If we don't give you pain medicines, then you can take Tylenol. Don't take any aspirin, ibuprofen, Aleve, or other NSAIDs because that can increase the risk of bleeding and theoretically increase the risk of a hematoma, which is like a blood collection at the site. I usually see people back at right around 1 week. At that point, we take out the stitches and evaluate the site. Following the appointment, I usually have people keep Vaseline on the site for another week. In terms of activities, the first week, we want you to be pretty relaxed, mellow at home. If it's a smaller site, then you can, go for a walk, do some low key activities. If it's a bigger thing, you definitely need to be kind of more resting. The second week, you can kind of increase your activities a little bit. The sutures will be out, and you can maybe be a little bit more aggressive walks. You can do some basic activities like chipping or putting at the golf practice area. You can shoot hoops if you play basketball. You can have a catch if you play baseball, but you just can't be like really exerting yourself or playing an active sport at that time. By 3 weeks, you can up it a little bit more, and then by 4 weeks, I say you can kind of resume normal activities. Two little areas within skin cancer reconstruction are forehead flaps or cheek flaps. These are a lot more involved than simple closures or rotation flaps. For these situations, it's a lot more intense recovery. So you will notice in either of these scenarios and it's usually for the nose that we do those, reconstructing nasal cancer defects. But if you have a forehead flap or a cheek flap, there'll be a pedicle, which is a bridge of tissue that's carrying the blood vessel to supply blood to the skin at the site, at the reconstructive site. That pedicle can be really oozy the first week. It can be really annoying. So same as the other incisions, you keep it really moist with the ointment, antibiotic ointment for 3 days, Vaseline after that. I usually also wrap some gauze. It's like a yellow type gauze called Xeroform that is trying to help decrease some of the bleeding. I'll take that off at 1 week when you come back to the office. But just mentally be prepared in the setting of the forehead flap or the cheek flap that there could be a lot of oozing from the operative site. And you have to kind of just figure out ways to put little gauze or, blood collecting gauze near the sites, just because it's just definitely a difficult thing to get through. But usually by 1 week, it's in a pretty good place where it's, the initial oozings calm down a lot. And then unfortunately you need to keep it in place for several more weeks, but it's not as bad as that first week. Skin grafts are another slightly different variation. In that situation, there'll be a bolster dressing. So a dressing or gauze, pile of gauze that's on the site and stitched down. For you guys who have the skin grafts, you don't really need to do anything other than keep that dressing moist in the same way, bacitracin for 3 days or Vaseline thereafter, and then Vaseline thereafter. I'll actually remove that bolster dressing in the office at 1 week. So if you don't know if you have a skin graft or another more traditional incision and you have a dressing there, make sure you call us before trying to remove the dressing. But we usually say, oh yeah, you had a skin graft, and you'll see little stitches holding it down. For bruising, other things you can do is you can take Arnica montana, which is a herbal supplement you can get at Whole Foods or other natural food health stores. You also want to try to keep your head elevated, which will decrease the bruising. The icing for the forehead flap and the cheek flap's a little difficult to do, but for the others, you can definitely do it. And then we would see you back at 1 week and kind of take everything off. Then post-operatively, I usually see people back around 1 month after the sutures are removed, because at that point I sometimes will inject steroids. Steroids can soften incisions and make them kind of more like normal skin. Sometimes incisions can be a little bit full. And then even further out from that, we have other things like laser or dermabrasion we can do to kind of blend the scars in a little bit better. So that's just a general kind of summary of important information in postoperative care for skin surgical sites, reconstruction sites from cancer, or taking out lesions like cysts and things like that. All right, hope this was helpful.